Good morning, children. Welcome to social class. Today I am going to start next part of your class, that is private health services. So once recall what we learned in our previous class. So we learned about the public healthcare system in the previous class. So we know that what is the role the government is playing for controlling that diseases and some of the pandemics in the region of India, and also explain that how many government doctors, means government medical students are coming out and how they are serving these all the things, even that how much the public sector in the region of hospitals was developed from starting onwards. Let us come with today's lesson. So before of that we have that two, also we know about the Kiran and also Sarita. So we know that how Kiran struggled for treating his illness and how Sarita treated her illness in the private hospitals. So there is a difference between private healthcare system and also the public healthcare system. So there we understand the role of government in the public sector, and now we are going to be learn about private health services. So what is meant by private health services? So in the public sector, what is the starting? We have that ASHA workers and Anganwadis and some other different type of hospitals, that is community centers, area hospitals and primary health centers like we have in the region of public sector side. Come with the private health sector, that you can say that private health services. We have a RMP. What we have? RMP. RMP means registered medical practitioner. So RMP means registered medical practitioner. So there is a wide ranges in the region of India's first private sector. RMP is called as registered medical practitioner. If you have any health issues, particularly in the region of rural side, where the hospitals, either from the government sector or from the private sector, where the hospitals was not available, where the doctor is not available for small issues like small accidents, for first aid, and also for cough, cold, fever, any small issues, you can consult to the RMP. And this person is just, he can treat the patients for small issues. You don't have a right and authority for doing that, even for stitches, even for surgeries, even for any other issues. So this person can found in the villages. First in the private sector we found this RMP. RMP means registered medical practitioner, and that is in the region of rural side. Why we don't have the private hospitals in the region of rural side? Rural means village side, because private main intention is profit. So private, they will start the hospitals in the region of urban side or else in the region of town, because there is a lot of people that you can found in the region of urban side, but in the region of villages we cannot get that more people. So private people, they want only the profit. For this issue they will start the hospitals particularly in the region of cities, not in the region of village. Either they can start in the region of big towns or else in the region of small towns also, because their main benefit, main thing was they want the profit. But public sector, otherwise called as government, they will start the hospitals even in the rural side, because public, or is called as governments, they want the welfare of the people, not for the profit. So government, they doesn't want the profit, they want the welfare. Welfare means development. So because of that purpose, they will start the hospitals either in the rural or else in the urban also. Now see that private starting, what the first person that RMP can found that is a starting person in the village level. He will start the practice, that you can say that registered medical practitioner and is a qualified but not a doctor, just like a somewhat. And is a one person, he will treat that small issues like cough, cold, fever, even that even any other small issues, first aid, doing first aid, these things are going to be comes under the control of RMP. Now see that cities level. See, in the region of cities, we have that in every street and every area, we have that doctors, and we have that big corporate hospitals, even that we have that labs, and we have that medical shops, even that surgical shops, along with that we have that Ayurveda, homeopathy, Unani, some other different type of hospitals that you can find in the region of cities. Even that we have and other purposes also we can find in the region of cities. Even we have that dental hospitals and also eye specialists or eye hospitals. These are the things that you can find in the region of cities. So private services that you can find more in the region of cities. Doctors are available, nurses otherwise called as sisters, nurse otherwise called as sisters, ward boys, and lot of hospitals, even the small hospitals run by one doctor, even that big hospitals that you can say that corporate hospitals in the region of, take an example, in the region of Hyderabad we have a KIMS, Continental, and also we have that citizen hospitals, NIMS hospitals, some different type of, even Apollo. There are some different type of hospitals which are comes under the control of private control. So we have in hospitals, we have a different type of doctors. Even there are some doctors also, they will open the clinic. Clinic means if you have any problem, directly you can consult to the doctor, and for particular doctor, and they will treat your diseases also. And labs, we have that blood test, X-rays, CT scan, MRI, even there's some different type of tests that can be conducted in the pathology and virology test. And we know that nowadays we have some different type of tests like a corona test. These all the tests can be done in the region of labs only. And we have that medical shops. Without medicines nowadays there is no survival. Every person, even though any small issue also, when we are going to consult with the doctors, they are giving some different type of medicines. Even the surgical shops for required for surgeries, blades, and these all the knife, these all the things you can find this. Other medical fields like Ayurveda medicines, homeopathy medicines, Unani medicines, and these all the things that you can find in the region of private areas. As the name suggested, private, we have that private hospitals, they will collect from the more from the people. So they will, once if you entered the private hospitals, they will collect that more money from the public. Take an example. In our lesson, we have an girl's name is called as Kiran, and also this Sarita, and Sarita spent more than 3,000 rupees, but Kiran spent only that 100 rupees. You see the difference between Kiran and Sarita. So the Kiran consulted to the public, that's a government hospitals, and the same problem. Kiran is also having the same problem, and Sarita is also having the same problem, and the both members consulted is different persons. One person consulted the private, one is consulted with the public. So because of, if you observe that the public 100 rupees equal to in the region of private 3000 rupees, that is 300 times. So the region private, they will think about the profit, there is no other issues. Public, they will think about the welfare of the people. But one difference between the private and public was, here is more people, less doctors, less facilities. Here is more doctors, more fees, more facilities that you can find in the region of private sector. So the region, maximum people, they are spending huge amount and they are going to the private hospitals because of that any issues. Today just I will read that private small concept is there, and you try to understand that. By keeping the textbook, we can go with the listening this lesson. Private. There is a wide range of private health facilities that exist in our country in the rural areas. One person found in the rural area, his name is registered medical practitioner. Another popular provider of healthcare is the untrained medical practitioners. So the maximum people, they cannot consult to the untrained medical practitioners. In urban areas, we have that large number of doctors and sisters, and also the specialized persons like a heart surgeon, bone surgeon, neurosurgeons, like that. And there is a lot of nursing homes, and there are some different type of private laboratories, and also blood labs can found this for the purpose of blood test, urine test, and some x-rays and ultrasound also. And large companies that run hospitals like, we know that Apollo, Kings, Medicare, Medicity, Medwin, and these are some different type of hospitals. And they're also engaging, means they're also running that medical shops in the region of every corner of the country. So as a name suggested, private health facilities are not owned or controlled by government. Unlike public health services, patients have to pay a lot of money in the region of private, but government, they cannot charge much. But in the region of private, they can consult huge amount from the public. That's, you try to read the concept. There is no much difficulty to understand this concept. Now see that health insurance. What is mean by health insurance? Health insurance means if you have any health problems like a major surgeries, or else call as if you are going to be on bed, then you can consult to the insurance companies. We have that Tata AIG, one of the insurance company, and also we have such different type of insurance companies like Star Health Insurance Company, lot of even the Reliance insurance company, HDFC is providing that insurance, medical insurance for the people. What is that insurance? For example, you have, for example, take you are the person name is called as A. A is paying every year some of the amount per year, 5,000, 6,000 for the health insurance, like is paying from long years onwards. Suddenly he got health problem, that is heart attack. What the health problem? Heart attack. So what is going to be get this things? You know, in the region of private hospitals, once if you consult with the private doctors for heart attack, they will take that more than 3 lakhs, 4 lakhs and 5 lakhs rupees also, based upon the damage to the heart. At the time, if you have the health insurance, with this insurance, if you consult to the hospital, the doctors through the insurance without collecting a money, they will do the surgery. So that is called as insurance. Particularly in the region of cities, maximum people nowadays, because they have more concern on the health issues, so the reason they are taking the health insurance. And because in the region of India, maximum people, they are spending much amount on food, clothes, shelter. Nowadays, even along with that, we're also spending money on health and also education. So because we don't know when the health problems are comes, so the reason there are some of the insurance companies, they are starting that health insurance. People also, they are, if they are, because paying monthly 10,000 or else 5,000 is not a burden, instead of paying that 5 lakh 6 lakhs rupees. So the reason there are some of the people, they are choosing that small amount, they are taking that health insurance by paying yearly amount, and if they have any health issues, even for major issues, they will consult to the health insurance. So health insurance are going to be supporting the people in any problems also. Now see that healthcare and family. So now see that government and private, how the government is taking care for the people and how it is going to be take the equality. So government will not consider the difference between one person to other person, and government is providing equal benefits to the each and every person. So the reason on this aspect, government is also, because once upon a time, people, those who don't have that much money, they are consulting to that private government hospitals. If any major issues, they are going to the private hospitals, because private hospitals was having that more facilities. So people, they like to choose for the private instead of giving priority for the government. Even that, but private was so expensive. But government means government is also having much concern onto the public. So they started that two schemes, 108 and also that 104 schemes. What is mean by 108? 108 means fast ambulance. What is mean by 108 fast ambulance? 108 fast ambulance means if we have any accident, just we can dial to the 108, and there is a customer care people, they will sit, and based upon your area, within a few minutes, either 5 minutes, 10 minutes of time, they will send the vehicle, the ambulance to your area. So this ambulance system is very popular in the region of India, and particularly in the region of Andhra Pradesh, because we don't know, Hyderabad is having that one of the fastest flowing and developing city. There we have that a lot of traffic is confounded. In this aspect, and this time, lot of accidents are going to be occurs frequently in the region of Hyderabad. Whenever you found this accident, just you can make call to the 108, and if you send say to the customer care people what is happened, in which area it is happened, that they will send that vehicle, that you can say that 108 for providing a fast ambulance services. Here they can find one nurse, one doctor, means trained doctor. They will come along with that 108 vehicle, and this vehicle is also having that oxygen is also. Come to that 104. So 104 is a one vehicle. They are sending to the rural areas, and after completion of checkup with all the people, they'll send the medicines. So required medicines they will send to the people after checking all the people. We know in some time the medical college people, they will come to the village and they will check the people's position, and after checking they will send that medicines. So 104 is a vehicle, they will send that medicines to require to the people. So these are the two is very important one. Try to understand that. So what is healthcare system? So everyone is having that more healthcare systems, and more health support also. Once upon a time, people they like to select the private hospitals. Even nowadays also they are selecting the private, because private hospitals are having that more benefits and also called as little flow, and new technology is also following that private hospitals. Along with that, government is also giving some support for the development of people by providing some facilities like 108 and also that 104. So what is 108? 108 is one service provided by government, that is fast ambulance services which is provided by the government. If any accident or any issue is happened, that you can consult to that, it means you can call to the 108 and they will send that ambulance and they will take to that near healthcare center to the person. Similarly, 104 is a one which is going to be supporting by, after checking all the people in the region of rural areas, they'll send the medicines for checking, and also the sending that medicines, they will use that 104 vehicles. See that in the region of India, 20% of the people, they are unable to bear the medicines fees also, because in the region of India, because India is not a well developed country and India is having that more middle class people. So 20% of the people, they are unable to bear that medicines fees also. It means, what is medicines? The tablet which we are taking there, are consuming that. So there are a lot of people, 20 out of 100%, 20% of the people, they are unable to pay the amount, because you understand that the income of those members was very less. Income of those members was very less. Because of that income, they are unable to bear that medical fees, or else called as medicines fees also. See that one more thing is, 40% of the people, 40% of the people, for any medical consult, they are selling their properties. Why they are selling their property? Because if any, take an example, if any person, they got that severe health issues and they are going for consultation of a doctors, and the doctor suggested for any surgery, the surgery cost was more than 3 lakhs or 4 lakhs or 5 lakhs rupees. For that surgery, there are some of the poor middle class people, they are unable to pay that amount. So what they are doing, that they are selling their property, whichever they have that. By selling their property, they are going with that. So because of that, middle class people is also, they're also becoming the poor. So these are the problems are going to be occurs. So 20% of people, they are unable to pay the medicines fees, and 40% of the people, they are unable to pay that surgery, otherwise any other equipment amount also. For that, they are also selling their properties also. So taking all these hospitals, loss of wages, and for example, take that there is a 4 members in the family. Out of 4 members, there is only 1 member is doing a job. Take an example, A, B, C, father and mother, small children, C and D. And B is having that health issues, she joined in the hospitals, and these 2 members cannot do any support, and father should stop the job, and when they stop the job, they lost the wages, and she has to take care about the B. So it means, if any issue is happened in a family, out of 4 members, if all the 3 are dependents and other member was joined in the hospitals, and they can be bear that lot of loss also. Even that we have a movie in Telugu, the name is called as Yatra movie. So there you can understand that there are 2 movies. I give you an example. One is the movie name is called as Yatra. One is the movie name is called as Vedam. In the movie of Yatra, there are 2 small girls and 1 mother. And out of the two girls, one girl is having that cardiac problem, means heart problem, and mother, she joined her in the hospital for doing in surgery. They're asking about some money for doing a surgery, and that is more than 2 lakhs. Is unable to bear that. Finally, that lady consulted to the particular persons. They accepted to give the money, but they're asking for the girl should be joined under that member as a maid and a pani manishi laga undalani aduguతారు. Finally, this is the thing is happened. You understand that for one small issue of the girl, another mother, she like to sell her other girl. This is the thing is happened, and in that movie you know that Rajsekhar Reddy, the role played by Mammootty, and what the step is taken that. So similarly, we have the system in present in the region of Telangana and Andhra was Aryogyasri. It means even the poor people, if they have any health issues, through the, if you have any that medical card, Aryogyasri card, we can consult to that any hospital either in private or else called as government hospital. They will treat freely to the public, but they'll collect some money nowadays, but once upon a time they are treating with the free of cost. So similarly, you see that a lot of people for any medical health problems, they are going to be sell their properties, even that anything, they are going to be save their people. This thing is going to be happen in the region of India. So once read the textbook, the doubts which you have that ask to me. So one more time I will revise what we learned today in our class and yesterday also. So our lesson was, what is our lesson? Lesson is public health and the government. Here you should understand that what is meant by a public health and what the role is playing by the government. So based upon the one example I given, that Sarita and Kiran, both are having that one is health private hospital, one is consulting for the government. You understand that how much money they spend and what the problem they both are facing. Similarly, we have that structure of public sector, public hospitals in the region of government sector. One is Asha workers, Anganwadis, and some different type of male doctors, female doctors, area hospitals, community health centers, primary health centers, and these are the things which we learned in our previous class. And also one more thing is, private hospitals is having very so high expensive. For consulting to the private hospitals, the people is losing that lot of properties. I explained that first primary step that you can found in the region of primary hospital was registered medical practitioner, and also other members is also there in the region of private hospitals, doctors, sisters, lab assistants, and ward boys, and medical shops, surgical shops, and labs for blood tests and urine tests, and these other things. Along with that, we have that some of the, because present days we have the health insurance. If any health problems we have that, we can consult with the doctor through the health insurance. But the insurance is providing by private companies or government companies to the people for treating to the any health issues. Similarly, health services providing by government through the 108, 104 services, and also we have the Aryogyasri, and these are the some services providing by government for better services to the people, for providing all the services to the public. Tomorrow I will explain the balance concept either in the Zoom section, otherwise in the region of video class only. Thank you very much.